Okay, thank you very much. So I'm now going to move on to the next section. Thank you very much for all that fantastic work that's going on in Stockbridge and elsewhere. It gives you an example of the sorts of things that we're doing. And of course, because this is ARC, we will be with our community partners and our community members undertaking evaluation and research of these initiatives and be writing that up. So following the pandemic, there has been investment in ARCs nationally to implement key innovations to help health and social care sectors navigate the challenges that it has brought. So I'd like to welcome Victoria Appleton from the ARC Northwest Coast Impact Team to present an insight into the work of the Beneficial Changes Network, which it is called, and in particular the Neonatal Induction Programme in neonatal care that we have been featuring in this national network. Victoria.
Hi everyone. So I'm just going to share my screen and get the slides up, so just bear with me. Can everyone see that? Yeah, I'm presuming no one's saying anything else and I can't see anybody, so I'm presuming you all can. So yeah, as Mark just introduced, and also we have presented the Beneficial Changes Network, the National Insight Priority Programme, and our neonatal work before a previous ArcFest. But the purpose of today is to not only give you an update on the BCN, the NIP and Nest at Home, but to also show how we've utilised a project which was Nest at Home from the Clark. We've brought it forward to the ARC, and how we're also using it for the Beneficial Changes Network and the National Insight Priority Programme. And that collaborative process, and also how we're working with the Innovation Agency and other ARCs nationally. So I'll skip forward. So I'm first going to introduce the Beneficial Changes Network, because like I said, some of you might already be aware of it, but we have a lot of acronyms. So you might just hear the BCN word, but not really know what it is. I'm going to talk about the NIP as well. I'm going to briefly discuss Nest at Home, which is our neonatal project. But I'm going to leave our PhD student, Ashley Sharp, to talk more about Nest at Home and the project. So I'm not repeating what Ashley will say later. So there's going to be a video from Ashley at the end. Also, Dr. Risha Gupta, who is the neonatologist at Lancashire Teaching Hospital. We're going to play a video with me discussing with her experience of working with the Clark, with the ARC, and also as part of the Beneficial Changes Network and the National Insight Priority Programme. So yeah, firstly, the background on the BCN, the Beneficial Changes Network. So NHS England established the BCN to capture innovations in health and care services that were, they might have already been implemented pre-COVID, or they might have been ready for implementation, or their intervention might have been changed or adapted. So it was to capture innovations that were maybe even accelerated or being slightly adapted or changed due to the COVID-19 pandemic. And the focus was on about sharing good practice through COVID. So NHS England asked the AHSNs, ARCs, Seed Alliances and other trusts and collaborations to see what innovations were out there and what good practice was currently going on. But the format of the responses and what they asked for wasn't really prescribed, and consequently, the amount of information they actually received, it varied greatly, and there was over 3,000 submissions of innovations that were proposed. Analysis was undertaken by evaluation specialists in the NHS England Improvement Directorate, and they put them into themes. The national themes were categorised into remote consultations, remote monitoring, new approaches to delivering services, and NHS and social care workforce issues. And then they kind of went back to us. This was meaning the ARCs, innovation agencies and other trusts, to propose innovations that fit under one of these themes. And we actually proposed 4 innovations or interventions or an example of good practice under each of the themes. I'm not going to discuss them today, and if you would like more information, then please email me or the impact email at the end, and we will give you some information about the other innovations or studies that we have been undertaking during or as part of the Beneficial Changes Network funding. But I'm focusing on NEST today because, like I said, it's a good example of how we have taken NEST from the Clark to the ARC. We've worked with the Innovation Agency, how the members been involved in all the way, and obviously the BCN and NIP has come out from it as well. So, like I said, we proposed 4 areas under each of the national themes, and within that we were working with colleagues from the Innovation Agency, but also the Beneficial Changes Network was a regional programme, so this was about understanding innovations and good practice from COVID regionally at this point. So we were working with the Northwest, across the Northwest region, with the ARC in Greater Manchester and the Innovation Agency in Manchester as well. So it wasn't just the Northwest Coast. And from this work, they then decided that it would also be good not just to share and understand what had been going on regionally, but also to upscale it and share it nationally. So to map the good practice that had been going on in different regions and map that good practice to a national programme. And that's where the NIP came from. Now, we submitted NEST at Home from one of our BCN projects. We thought that NEST at Home would be appropriate to understand what had been going on nationally with early supported discharge pathways of neonates nationally, because as we came to look at it, there was some variation nationally. And when we did propose it and talk to the other ARCs, there was interest as well from the other ARCs to know what had been going on in neonatal units during COVID, and how neonatal units were supporting discharge pathways for neonates, late preterm neonates. So we proposed it, and we then received NIP funding as well. So I think the last ArcFest, we hadn't received the National Insight Priority Programme funding at that point. So we were focusing on the BCN stuff and the BCN work, but we have received the NIP funding for early supported neonatal discharge pathways. So what is the National Insight Priority Programme? So the findings, like I said, from the BCN, so that's regional work, will be used to feed into a larger programme, which is the NIP, so the National Insight Prioritisation Programme. And that's to understand what's been going on in the regions, to map it nationally, to share that good practice nationally. So the project for NIP is also supported by the Innovation Agency, and we are helping the Innovation Agency to do this work and do this bid. So the NIP received funding from the NHR to map, like I said, good practice to other trusts and similar services. So for us, it's understanding what's been going on across the neonatal trusts with their early supported discharge pathways. And overall, the NIP aims to accelerate the evaluation and implementation of promising innovation. So it's not just neonatal, there's lots of other projects that are going on under the NIP. But for us in the ARC Northwest Coast, it's the neonatal project that we're focusing on. And it's to support post-pandemic ways of working, to build service resilience and deliver benefits to patients. So it's about sharing that good practice, embedding it and continuing it post-COVID. And the NIP, like the ARC, has the overall aim to reduce health inequalities, so equitable access to the services and the innovation across the country to reduce health inequalities. So early supported transfer of care. So I don't want to talk about this too much because our PhD student will discuss it in one of the videos, but I just thought I'd give you a bit of a background of why it's important, how this NEST project and the neonatal early supported transfer of care pathway was started in the Clark, how then we adopted it and put it through to the ARC, and then I've put it into the BCN. The NIP and a PhD student has also come from this work as well. So Why is it important? Neonatal early supported transfer home. So 6 to 7% of babies are born 4 to 6 weeks early. So they're not the really prem babies, but they need a bit of support in the neonatal unit. 6 to 7% of babies is actually quite a lot. And they, like I said, require a little bit of specialist care. And being in the neonatal unit can cause health inequalities, even for a little bit of time. It's got financial stress on the family. The length of hospital stay can impact not just the family's mental health, but also the financial, and the length of stay can impact the hospital because it costs the hospital money. It can impact on breastfeeding, a baby's development, and that separation and overall attachment between parents and child. So Nest at Home was a care pathway, and it was developed at Royal Preston Hospital, so Lancashire Teaching Hospitals Trust. And when it was brought to the clerk, they wanted to do an evaluation of the discharge processes that were currently going on in Lancashire for late preterm infants. So it was part of the Clark Partner Priority Programme. And what did the clerk do? So at this point, they did a literature review, they did stakeholder engagement events and parents questionnaires and discussion groups to understand what mattered to parents, what the trusts and staff felt was needed to have a successful discharge process for these late preterm infants. So it was found that parents were confused about the discharge process and could become frustrated if they were given a day to be discharged and it didn't happen. Staff felt that to have a discharge process that ran smoothly and also to get preterm infants home earlier, they would need themselves and the parents to be trained in maybe gastric tube feeding, or just a little bit of care around breathing or first aid. So they needed to prepare, staff and parents felt they needed to be prepared to be discharged as well. There was feelings around guilt, parents adopting this new role as parents. So there was lots of issues that were identified during this Clark research of understanding what a transfer home pathway should look like. And they felt that if they could develop a good pathway and a good early transfer home that was provided parents with enough support, then it could actually reduce health inequalities as well. So the CFA, I think if you've come to an art fest or you're involved in the art, you'll have heard us talk about the CFA before, which is the Consolidated Framework for Implementation Research. And the clerk used this to understand the findings that they were getting from the systematic review, talking to stakeholders and parents and staff, and they created an implementation plan to look at how outreach services could work to get preterm infants home. So this was what the clerk developed and became known as Nest at Home, and it was an implementation plan for early supported of discharge or transfer home. So Clark recommended that secure resources to recruit and train staff were needed, so they'd have the capacity as an outreach team to support parents and neonates to be transferred home. They wanted Nest at Home to be implemented across all of Lancashire, so that every baby born between 4 and 6 weeks that fitted the criteria could be transferred home earlier. And they wanted to evaluate Nest in terms of reduced length of stay and equitable access to understand what was working and what wasn't working. And they also wanted to have a flow diagram so that parents and staff could be aware of an escalation processes in terms of if a baby was becoming a little bit unwell, if they needed to go back to hospital. So it was clear to all. And then if it was successful, then they wanted to upscale Nest at Home and have a clear implementation plan and pathway across Lancashire so that babies could be discharged when they fit the criteria. But then if it really did work, to develop an implementation plan for more complex children and or babies so they could be discharged as well. But we all know COVID changed the way interventions were implemented. Some were rolled out rapidly, some were completely or changed or adapted, and the implementation process was also changed. So we knew that Nest at Home was something that Lancashire Trust wanted and the parents wanted. We knew that it was starting to be rolled out just before COVID hit. And then when we spoke to the Trust, we were getting an understanding that actually Nest had proved really useful for staff and parents during COVID to get neonates home earlier and reduce that anxiety of a neonate being in hospital during the time of COVID. So that's why we thought it was a great candidate for the Beneficial Changes Network and NIP. We thought it was good practice. We'd already had a good relationship and partnership, and it's something that had gone from the Clark to the ARC. So I'm going to ask Dave to play a video now, and this is with Dr. Risha Gupta. As I said, she's the consultant neonatologist and developed or helped develop Nest at Home. It'll probably repeat some of the stuff I've already said, but it would be nice for you to hear from her experience, her understanding of the BCN, NIP, how she's engaged with us at the ARC and how that relationship's developed from the Clark. We have been quite efficient, and we recorded this at Christmas for an ARC Fest, so please ignore the Christmas decorations in the back. But yeah, Dave, could you play the video, please? Hi Risha, so can you tell me a bit about Nest at Home?
So Nest at Home is a co-produced service intervention that offers a family integrated approach and personalised home support package to enable late preterm babies to be safely transferred home earlier. It's supported by an enhanced neonatal outreach nursing service. This intervention is needed to address the widening health inequalities for late preterm babies and their families by reducing their hospital length of stay and reducing newborn, maternal and family infant separation. And hopefully with this also help to improve successful establishment of breastfeeding.
Thank you. And can you tell me a bit about your role with Nest at Home and also how you have worked in collaboration with the ARC?
So I started working on the project in 2017 as part of a sequin when we put the project forward to the Clark and managed to get one of our nursing team as a academic internship to look at parental views on the service. So we did a survey and a questionnaire evaluating what their perceptions of the service were, the benefits of it and the issues they had in the discharge process. And that was compiled into a report that was presented at the Clark. So that's helped us to demonstrate the value of it to our trust to keep it going as a service. The ARC has helped us because we're now applying through some funding from the Beneficial Changes Network to evaluate the impact of COVID on transfer home processes during that period. We want to be able to scope the parental views and perceptions of how the service has helped parents during that difficult time when they couldn't access the other universal services. So the ARC has put forward protocols, which means that we've got the funding from the Beneficial Changes Network to help us evaluate the Nest at Home programme over that period of time.
Thank you. And then can you outline the future steps for working in collaboration with the ARC?
Well, yes, because once we've got some of that qualitative information, we also want to be able to look and see how Nest at Home works as a service compared to other early transfer home services. So there is funding also from the National Priorities Programme to help us look at the benefits and the processes that we've used to hopefully see how they can help with other transfer home services as well, because I think there's a lot of generic learning that could be used for a wider population of patients.
Thank you. Thanks for your time, Risha.
Thank you.
Hi everyone. Right, I just need to share my screen again. There we go. So as Risha just touched upon then, the updates and next steps, and I'll just go over them. So like I've said and Risha said, the BCN Nest at Home has had a name taken from the Clark work, which is to look at equitable access for everybody. It wants to identify looking at readmission rates and also more questionnaires and interviews with staff and parents, what they feel is good about it, what's missing, what can be changed. So that's part of the BCN. And MindAS, which is one of the other cross-cutting themes at the Arc North West Coast, have completed an evidence sift for Nest, and they have also currently undertaken the systematic review to inform and support our BCN work. We want to share the systematic review and the interviews and questionnaires that we are currently doing with staff and parents. And then from that'll form the BCN work. From that, we want to scale up and disseminate it and do some mapping with other early supported discharge pathways, and that is going to be part of the NIP. So in summary, we're developing and increasing the evidence base for the BCN work, and we're working collaboratively in our region, so with the Arc North West Coast, which is us, and Greater Manchester Arc North West Coast and the Innovation Agency. And then we're also working with them to do the scale up of early supported transfer of care home pathways, to share that our good practice, but to understand what other people are doing nationally, to create a national implementation plan. And of course, we want to publish our findings for both the BCN and NIP. And like I said, we want to have an overall best practice implementation plan of early supported discharge pathways. So lastly, I'm going to leave you with our PhD student, Ashley Sharp. This is the first time she's presented at an ArcFest or actually presented her PhD. So please be kind to her. And she's just going to discuss how the Nest at Home work and the BCN and the NIP, all that has informed and helped her develop her research question, and how she's taking a bit of early supported transfer pathways and she's looking at the mental health of the parents. So Dave, can you play the last video? Thank you.
Hi, my name's Ashley Sharp. I'm a PhD student in UCLan and with the ARC Impact. I've got a background in psychology and children's nursing. I worked in a large children's NHS Foundation trust for a while and worked as an RA in children coming to hospital and implementation studies. Global statistics indicate that rates of preterm birth are at 10% and rising. Late preterm infants are born between 4 to 6 weeks early and often need intensive and specialist treatment in a neonatal unit. This can lead to a negative impact upon the parents and infants due to separation, lack of breastfeeding and feeling of not being involved in the care of their infants. Infant admission to neonatal care can have implications for ongoing child maternal health, health service resources and parenting and care practices. Parents of premature and sick infants are reported to be at high risk of poor emotional functioning, anxiety and mood disorders. Postpartum depression is one of the most common complications of childbirth amongst mothers who have term or preterm births. Parents of infants in the neonatal intensive care unit have been identified as experiencing higher rates of postpartum depression related to their infant's medical vulnerability or the stress of the NICU stay. A study has found that the risk of postpartum depression is much higher in mothers of preterm infants who have experienced a neonatal admission when compared to term infants who do not experience a neonatal admission. They also found that while the rates of postpartum depression decrease over time in both groups, they continue to remain higher in the preterm maternal group during the infant's first year. While rates of postpartum depression in fathers are identified as between 2 to 19%, there is little research in this area. Stress is noted to increase a father's transition with their infants from NICU to home and may become a risk for increased depression. This has also been found to be the case with mothers of infants discharged from NICU.
Thanks, everyone. I think that cut off a bit short at the end, but we should be all right. So that is the end of our presentation. As I said, we just wanted to show how we've worked in collaboration with one of our member organisations. We've taken through some legacy work from the clerk, and also what the BCN and NIP is, because I know a few of you will have heard it mentioned, but not really know what it is. So yeah, are there any questions?
Let's look at the chat. Can't see any. If you have a question for Victoria, either raise your hand, as I'm just doing there, it's in the bottom on your screen, and then lower it again, or put something in the chat. Can't see any hands being raised or any questions. That's probably did such a comprehensive job, Victoria. So if you don't mind, I'm going to move us on to our next section.